same drive, I'm on the same drive. No more doubts, I'm feeling alive. With every mile I leave the past behind. Same drive, this is my state of mind.
'While young adults ages 18 to 25 have the highest rate of drug use across the board, drug use among older adults ages 26 to 49 is also on the rise. The use of drugs including marijuana, cocaine, methamphetamine, alcohol, illicit opioids, as well as other prescription drug misuse is persistently on the rise. The pressure on adults are real, and this pressure include building career, passing exams, buying homes, getting married, having kids, coping with peer pressure, and also showing off. Trying to do this all well comes at a lot of cost and also a lot of pressure. And some of us tend to turn to drug as a coping mechanism. The regular or habitual use of these drugs become a crutch and only adds to the stress. And just because a drug is termed legal doesn't make it less harmful. Welcome to Sanity podcast, everyone. My name is Nosarime Abe and I'm your host for today. We'll be discussing substance use disorder and its engagement in brain health. Substance use disorder is a compulsive use of substance, and the repeated use of these substances can lead to profound changes in the brain structure and function, affecting regions that are responsible for reward, motivation, for cognition, self-control, and also judgment. Taking a pause, it is important that we recognize that substance use disorder is not just about moral failure or lack of good parenting or willpower. It's a complex medical condition that requires comprehensive treatment and support, and that is why we'll be discussing this today. I'll be joined by Eniola Usman to discuss this very critical topic, and I'll leave the floor for Eniola to introduce himself.
Thank you so much for having me on this platform. Let me do a formal introduction. My name is Eniola Utman. I'm a clinical psychologist with the Lagos State University Teaching Hospital. I had experiences in forensic aspects of psychology as well as clinical aspects of psychology. Previously, I was working with a private security outfit. I'm glad that you could invite me for this discourse.
Yeah, so substance use disorder affects millions of people worldwide. And one major problem is that this topic is often misunderstood. So let us start off on this note, understanding what substance use disorder really is. I mean, looking at the basics. Annie, can you make our listeners have a clear definition of what substance use disorder is? How does it differ from the casual substance use? And also, using some of those your key indicators, bring us closer to what the field of substance use disorder is.
Thank you very much, Nosa. Substance use disorder is a mental health condition characterized by consistent use of psychoactive substances despite the harmful consequences. Substance use disorder is also a cluster of cognitive, behavioral, and physiological internal factors or drives that propels and sustains an individual to use substances, focusing more on psychoactive substances. Now, you see that combination focuses on three domains: cognition, the individual's thought process; behavior, which is a product of an individual's interaction with the environment; and physiological factors, which is looking at it from the biological aspect. So, and this side was gotten from the ICD-11. ICD-11 is by the World Health Organization. The criteria they use in classifying various diseases and all, which also brings about the factor that it is actually a chronic relapsing brain disease, because it's something that it's a disease, but a lot of people just see it as an habit, but it's actually a brain disease because the substance itself changed the chemical composition of the brain, and the brain starts functioning in an unhealthy way, and that in turn affects the behavior and even the thought process of the individual.
Great clarity there, Annie. That brings us to this critical point. How do these substances affect our brain, and why do they have to lead to such compulsive behavior? Touching on the psychopharmacological aspect of it.
Okay, so like I mentioned in the aspect that it's a chronic brain disease, and that looking at it biologically, it's the dopamine levels of the brain being increased as a result of the substance itself. Every medication has a target tissue, but psychoactive substances are called psychoactive substance because those substances focus on the central nervous system, especially the brain functioning. And for instance, instinctive, biological, and natural release of dopamine in the brain. The brain releases the right amount of dopamine that makes you feel good, that makes you feel happy. But certain psychoactive substances, they force the brain to play this function without actually having a proper stimulus that will enable the brain elicit it the right way and the right amount. As a result, you're forcing the brain to start functioning in the way that it's not meant to. And one thing about some of these substances, there are prescription medications that are often at times abused, such as codeine, such as Refenol, Tramadol, and the likes. They have their dosage, and they have the role it plays in the body and the quantity it's meant to be. And as a result of that, so let's use marijuana, which is the most common. There's no dosage that you can actually be sure of. All you know is that this particular strand might be extremely high. You say loud, is extremely high. You say Colorado, but you can't really quantify it. So an individual taking that, the brain starts, depending on the strength of the chemical composition of that particular substance, the brain reacts to it, and consistent use of it damages it. And there's what we call tolerance. When tolerance occurs, the certain quantity or dose of a particular thing that elicits or stimulates a particular reaction from the individual or the brain would need to be increased over time to get that same satisfaction. So as a result, the person is hooked. The person is taking more and more, and the brain is craving it more and more. So that's just focusing on this discourse from a psychopharmacological aspect. And
that was enlightening, Penny. Thank you so much for that. Moving on. What are some of the factors that could predispose to or make someone more vulnerable to developing substance use disorder?
Okay, I would like to look at that particular question from a nature-nurture aspect. Nature talks about genetic coding, talks about if someone in the biological line is having that particular trait of either alcohol use, either substance use. So genetics is a factor, which is nature. Then nurture is also a factor, the person's environment. The most common aspect of nurture is peer pressure, when the individuals start interacting socially. So psychosocial factors come in, you want to be cool. So the people you meet in school, you see that this person is intelligent, something cool about this person, and he uses or she uses, and you want to belong. And the aspect is that these substances are addictive. So it's not something that the earlier you stop, the better. The more you continue, the harder it will be to stop. So there's also upbringing. People living in an environment where they sell easily. You stay in a garage, or you stay in a particular apartment that there's a dealer that stays there, and people come to buy there. It's a place that is not easy for law enforcement to get to, and people smoke there, and you, as a child, you've been passing. It's something that you see as normal. So the environmental aspect too has a great role it plays. Now, this environmental aspect too can work for or against, just as genetics too can. There are people that will be in that same environment, but because of the innate purity, as one theory states it, the individual still doesn't budge to using substance. And at the same time, it might be that same genetic factor, an individual who is not in an environment that is influencing in any way to use substance, will, because of something innate, something physiological. Remember that definition, that it is a cluster of cognitive, behavioral, physiological. So the nature focuses more on physiological aspects, and even cognitive, as the case may be. Nurture focuses on the behavioral aspect and aspect of cognition as well. So these are factors that can influence substance use or substance dependence, as the case may be.
So in essence, our biology and our surroundings have critical role to play in predisposing us to substance use disorder. Thank you very much, Eni, for that wonderful response to the question. Now, let me show this to you right away. Looking through the lens of a clinical psychologist with diversified field experience, what are some of the specific red flags that individuals, parents, guardians, or even family members should watch out for in the context of substance use disorder?
Okay, so it's always a good thing to have a loving and caring environment whereby there are people paying attention, and because a lot of this substance use starts at adolescence and young adulthood. There are some key things that loved ones can actually watch out for. Some of these substances have physiological effects on the person's physique. For instance, when an individual is high, as the term is, that's what we call glass eyes. And for the individual to actually keep it a secret, the person wears shades or something. So for instance, you can see a person wearing shades at night. And you know the funny thing, a lot of these traits have been inculcated as being cool. So it's cool to be wearing shades at night. But in actual fact, the real core was that, you don't want people to see that your eyes are actually extremely red or are numb or flat, as the case may be. So, and there are also physical features that the individual did not have before. For instance, nicotine addiction. Before they started smoking, their fingers, their teeth, their lips, and the likes, depending on the features of the individual, it varies really. Over time, you see a difference in the color of the teeth, in the lips and the likes. So marijuana too, as a result, and other substances that are smoked consistently, there will be a physiological change in some of these things. Then in terms of behavior, there's this saying that they say birds of the same feather flock together. You observant of the pair of the company the person is keeping, and you can tell. There's a thing that people don't really get that the police use: profiling. Now, you might be on a bike, maybe the individual is 25 years old, but because of a certain way you're dressed, because of certain looks, features, physical features as well, your lips, or you're wearing shades, and it might even be in the day, you observe that when you stop at a checkpoint, even if you're on bike in some locations, you get stopped. The bike gets stopped, and they might search your bag. They might look. It's profiling. It's because of features, these physical features that they see. They are trained to see it, or as a result of experience in law enforcement, they see the consistency in this look. So a lot of times when you want to dress hip as a teenager or as a young adult, you want to look in a certain way that you see on music videos and the likes, you are actually creating a profile that can sometimes be associated or be a common trait with substance use. So now, am I saying that there's a way an individual who's abusing substance dresses? No, but it's just traits. Looks, the lips being dark, always on shades because of your eyes. Those are physical things to watch out for. Behaviorally, withdrawal is another thing. The individual won't be as interactive and free as much as they used to be, because they know that if they open up as freely as they used to, sooner it will come out sooner than later. So these are some of the things to watch out for and to guide against.
So now let's shift our focus a bit to the merits or the myths that surround substance use disorders. Substances are often marketed with promises of pleasure or escape. A lot of people had to grapple with some of these experiences. Eni, can you talk more about the merits, the demerits, and the common fallacies that are propagated by some of those dealers?
Okay, so for every product to push sales, there must be marketing. Now, some products, when they are being marketed, some qualities are overemphasized on, and some other traits that are not too attractive will be downplayed. So that's when you see an advertisement on TV and they want to say terms and conditions. The advert itself takes quite a while. Narrator talks, the video is bright. When they are going to say the terms and conditions, it will be said very fast and it will be written very tiny on the screen. Now, there's something a revolution that happened in the tobacco industry. For instance, I think about 20 years back, or let's say 30 or 25 years back, a tobacco company, cigarette company, can actually advertise on paper and put billboards, could advertise on TV, on radio, and the advert was pushing sales of cigarette. But when the effect of lung cancer was being advocated for by NGOs and all that, consistent fights, consistent court cases and all, gradually they started creating that, okay, the adverts should be from a certain time. The advert, it should be mentioned that smokers are liable to die young. Then gradually over times, they change it to smokers will die young. Then at a particular time, on the cases of the cigarette, they put the pictures of burnt lungs and all that. It is legal criteria that the tobacco or the manufacturing company had to comply with. Now, smoking of tobacco is not illegal in most places. There's the core tobacco that is stronger. I think they call it Cuban. It's illegal in some states in America, or even in America, because it's thicker and all that. At a point in America, there's a crime they call bootlegging, and that is people who sell whiskey, who smuggle whiskey and into. But now, whiskey is being sold. In fact, very luxurious advertisements. The point I'm driving at is this: that the sellers will always want to sell, even though they know that what they are selling can cause psychosis. And psychosis is when the person becomes or is in another reality. That's when the likes of hallucinations occurring. The person seeing, hearing, feeling things that are not really there, called schizophrenia. It's the crown of mental illness in my own book, because the cases are quite alarming, as the case may be. And from experience, in terms of patients handled, I'm quite aware that about 80% of patients I handled that I've treated or managed for schizophrenia had an history of substance use, mostly marijuana. There are some that have used other psychoactive substances as well. So the point is this: the person selling will always hype it that you want to read to make you a lot retentive, you get it that once you want to start it. And truly, it's a psychoactive substance. It will mess with the mind, but the consequence is what is not emphasized on, which is the psychosis. Now, there's some people that say, oh, you want to be creative, like artists. A lot of artists, see it as a way of getting inspiration. Others have seen it as a proof that this person sang this song and this, but they don't see a lot of people that smoke that did not blow. Let me use that common word, an artist blowing. So, but they still focus on things that they've seen people that smoke that have achieved, and they use it as a selling point. There's a treatment process we do that we let the person list the benefits of what the things they've enjoyed and the things that they've lost, and those that gain insight quicker are able to identify great things they've lost, and the losses often outweighs times 3, times 4 of the gain. The gain is always that feeling of pleasure, of comfort, or feeling good, or being seen as cool, or it's always things that could be derived or satisfied in another healthy way. But the losses are always much more in terms of health, in terms of costs to their health, financial costs as a result of the health issues that has arisen as a result of how they have behaved, people they've mistreated or maltreated, unknown to them. Their behavior is as a result of the substance. They'll be like, but I didn't do that when I was high. But the brain is being damaged. The brain is sustaining or feeding off it because you've introduced it into the system and tolerance has taken place. So it's still in the system even when you're not high at that point. It still has damaged things that is making your interpretation of things or being more irritable, or getting angry easily, or talking to people without regard or remorse and all that. These are just few of the many destructive things that substance does that dealers will not push, will not say. They'll give you flimsy thing that make sure there's no dirt inside the weed when you are grinding it. So you too, you feel like, oh, if I'll tell you that know your gauge. If you know your gauge, you know when to stop, and you can always, if it's Colorado, don't take more than this. They will be trying to do pharmacy for you, but the truth of the matter is that it's destroying you, and they just want to make money. And drug dealers make a lot of money. And there's this common saying in drug business: never get high on your own supply. So why do they say it? Because they are able to think straight.
That's So now, bringing the misconceptions to the public, let's try to debunk some of these myths. What are some other myths and misconceptions that you know about, that you've heard about based on your field experience around substance use that our listeners should be aware of? And please, Annie, try to help us debunk some of them as much as you can.
Well, I'll go deeper in this as a result of you emphasizing on it, and I'll give examples for people who speak Yoruba and who are conversant with commercial drivers in Lagos, how sometimes they drive in a dangerous way that puts the danger to themselves and their passengers and even others around. And one common norm or non-common belief they have that you can't drive with ordinary eye, that you have to be high to drive. So in the morning you see them in these small places. They will go and smoke, drink spirit, smoke cannabis or hardcore raw spirit with all sorts of herbs and all that in it. They now set out in the morning very early and start driving without remorse or following traffic rules, and they've cost a lot of people their lives. They've done activities that truly show that people say something wrong with this person. Yes, there's actually something wrong with the person, because the person is intoxicated, the person is not in the right frame of mind. But the goal or the idea is that they need it to operate, that without it they can't function. Because the easiest place to get cannabis is at garages, and that's why it is being sold there. Now it is still that same mindset, that negative mindset, that if you want to do anything, you need the mind to do it, alter your smoke ego and all that. And that's what is linked directly to the brain being damaged. The brain feels it cannot function anymore without it. So the brain physiologically, biologically influences your pattern of behavior, influences your cognition, your mindset, and all, guiding you towards consistent and maintaining the use of that substance, because you feel you can't function without it. Now, that is why during treatment, there's the detoxification, there's the withdrawal symptoms that happen, because your brain now at that point in time is being repaired, is adjusting without those things. So that's when for people that have been using strong narcotics such as heroin and the likes, they start throwing up, they start sweating profusely and all that. The people that have been using cannabis and all that, their hands are always itching, or So now the conception of that you need it to function, that is what I'm trying to debunk. It's just heightening the brain forcefully and damaging it as a result, and making you dependent on it. In ICD-11, it's even referred to as substance dependence. The DSM-5 is what looks at it more as substance use disorder.
Building on the response we gave to the previous question, why is recovery so challenging?
So, like one of the definitions I gave about it being a chronic relapsing brain disease, it is not something that can be overcome easily or by yourself. That is why social support is very important. That is why a lot of times rehabilitation centers are more effective, in that it will require others to assist the person, always being monitored, so that the person doesn't fall into depression, such as a lot of cases that happen because the person feels that they're not being loved or being trusted. But the person identifying, or the patient or client identifying that they need support and they need help, building insight, that is one major important thing. In motivational interviews, that is why what we do often, we try to guide the person to the desired behavior. Let the person himself come to that knowledge, to that insightful state. So now, in rehabilitation centers, we have psychiatrists who aid in terms of chemical aspects in medication and even in diagnosing. We have clinical psychologists as well who do psychotherapy, as the case may be, trying to manage the depressive aspects of it, trying to manage the insight building and various forms, using various forms of therapy that may be needed. Then we have occupational therapists as well who will work towards or guide the person in looking for productive ways of living and making a living. Because idleness is one of the major factors that also push individuals to relapse. When the individual is idle, when the individual is not productively active. Yeah, definitely, as a saying goes, an idle mind is the devil's workshop. So, in actual fact, it need for social support. Caregivers, rather. We have formal caregivers and informal caregivers. So, formal caregivers are the professionals in terms of clinical psychologists, psychiatrists, psychiatric nurses, occupational therapists, and the likes. While the informal caregivers are your friends and family. They are the ones that will be there for you when you get out of rehab, when you've recovered. And recovery, you can always relapse because at that point in time, you need to put into play the things that you have been taught in rehabilitation, coping skills, the trainings you've received. Yes. So
now, riding on that, can you briefly talk about some of the effective treatment approach that could work for substance use disorder?
Well, majorly it's going to be an insight building therapy, insight oriented therapy rather. The individual doesn't necessarily need to hear that this thing is bad for you. Yeah, stop it, stop using it. It's not him here or her hearing it. Self-discovery, person being insightful on his own. That's why that task is given. It's not always easy for the individual, even when they know. It's always difficult because there's a lot of biological aspects to it, and there's a lot of thought processes that need to be adjusted and cognitive errors corrected and identified. And the truth of the matter is that, we mentioned that there's a nature and nurture aspect of it. The cognitive aspect is a very key aspect, and once we are able to correct the wrong mindsets, correct errors or beliefs that drug dealers and years of false information have been identified and corrected, the person has a better chance. So all sorts, we can use CBT, we could use motivational interview, general trade crafts, so to speak.
Thank you so much, Annie. I hope I'm not stretching beyond the limits. Getting someone like you with this much experience, we need to get as much information that we can get as much as possible. So permit me to ask this one more question. So let me pick you up lastly on the last point you made about the role of social support and also caregiver in recovery. How can they make a difference?
It's to never give up on your loved ones. Never give up on them. The fact that they are in it, it's a battle. An uphill battle that cannot be fought alone. You see your experiences with them and just want to let go of them, and that's why we have a lot of people on the road who have one form of psychosis or the other, and they are family members, but the family members have tried so hard, but they still kept on using, and it destroyed them gradually. So informal caregiver, the loved ones, they felt that, I have my own life to live. It is what it is, and they let go. And when it comes to his right frame of mind and senses. But that will never happen on its own. The individual may feel it and end up being depressed that what's happening, but he will still be using, she will still be using. And it takes consistent support, consistent help. Following the treatment plan as well. Never give up on your loved one. A lot of times, ignorantly, especially the young ones, that There's this generation we call the Gen Z generation now. The mindsets are quite different from the millennials. So every generation with their weaknesses, and there's a gap in each of the generations. And that gap can be more frustrating than even the substance itself, because you won't see it as the substance being the problem. You see it that this is just this person. But remember, it is a chronic relapsing brain disease. Don't be emotional about it, be objective.
Thank you so much, Eniola Usman, for joining us and sharing your expertise with us today. This has been an enlightening discussion, and we're happy you made out time to be part of it. Thank you again, everyone, for joining this episode of Sanity Podcast. And just to leave this with you, avoiding high-risk situations, engaging in healthy activities, and practicing stress management techniques could help prevent substance use disorder, even if you're genetically predisposed to it. Addressing some of the underlying mental health issues that we have beforehand, like depression and anxiety, could reduce the risk of self-medicating, which could degenerate into substance use disorder. And it is important for us to remember that asking for help is normal, and you should never take on the entire world on yourself alone. If you're concerned that you or someone around you or someone in your life is drinking too much or is using drugs or dealing with mental illness, please reach out. There are government hospitals with certified clinicians and clinical psychologists and psychiatrists that will be able to guide you through before it degenerates to something that may not be manageable. And there are resources online that may be able to help to navigate through some of these conditions. For example, Substance Use and Mental Health Service Administration is an international website that has some articles or resources or even email through which you can reach out to someone that you need help, and they might be able to guide you through how you can go about it. So thank you for being a part of Sanity Drive Podcast. Stay informed, stay supportive, and take care of your sanity. Until next time, bye.
Same drive, I'm on the same drive. No more doubts, I'm feeling alive. With every mile I leave the past